Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello. Welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore the many dimensions of human connection, pleasure, and healing. You are tuned in to episode 44, Couples, Cancer, and Intimacy. I want to take a moment to sincerely thank you for joining us live or on the recording. I am so truly grateful for you. You are the whole reason this podcast exists, and we thank you for tuning in. To my incredible urology nurse colleagues, thank you for showing up every day with compassion, with skill, with humor and heart. You care for patients at their most vulnerable moments and make intimate, often difficult conversations feel safe, normal, and hopeful. Your expertise changes lives, your presence heals, and your dedication inspires. I am so honored to be in this specialty with you. Happy Urology Nurses Week. You make a profound difference. Happy Urology Nurses Week. We're on social media. We are out there on Facebook. We're on YouTube. We're on X. We're on LinkedIn, Kick. We're out there. If you're on X and you need to ask a question, you can go to YouTube, LinkedIn, Facebook, Kick, or StreamYard to ask those questions. If you are a Facebook person, please follow us. The more people that follow us, the more we can do on Facebook. And so we really appreciate all of our followers. Thank you to our faithful fans and followers. We are out there also on our website. So please, the website, can you believe it? There's 43 previous episodes and you can pull any of them up and watch them at your leisure. You can pull up the calendar and see what's coming up next. So go to the website and please watch whatever episodes you want. I'm so proud of the amazing experts who have come on and shared their expertise. And there's lots of good stuff on there for you. So go to the website. If you're in your car, if you're working out, listen to us. We are on your favorite streaming service like Spotify, Amazon Music, iHeartRadio. We're there with you while you're working out, while you're doing whatever you're doing. Tune in to us. We're right there with you as you go. I like to remind everyone each time that all are welcome here. You are so welcome in this space. Whatever your sexual orientation, your gender identity, or your relationship style, or lack of relationship style, whatever that is, you are welcome here to learn and listen. So thank you for being here. The goal of the podcast is pretty simple. It's just to empower and enlighten you with the scientifically based information you need to make your own informed decisions. And that is all so that you can improve your sexual health, deepen your relationships so you can live and you can love this one miraculous life. You can live it more fully, more wholeheartedly. And that's why we're here. That's it. No hidden agendas, just to help you get the information you need to do that. So today, wow. Each episode is so amazing, and I thank you for being a follower and listener. We're exploring something that touches so many lives, but is rarely talked about openly. How couples find their way back to connection, love, and intimacy after a cancer diagnosis. I have had 2 of my own cancer diagnoses in my life, and when you hear the word cancer, it shakes your world, it rocks your world, and it can change everything. Cancer changes our bodies, our self, our sense of ourself, and often our relationships. But intimacy isn't just about sex. Intimacy, it's about closeness. It's about communication and feeling emotionally safe with each other, even when life feels very uncertain. I think that's the hardest thing about some of the medical issues is the uncertainty. What's next? What's going to happen? But to help us to understand this, how couples can navigate this journey with compassion and honesty, I am joined by, I get to meet these amazing people in my field, and this is truly one of them. I am joined by the wonderful Dr. Ann Katz. She is a true pioneer in helping people rediscover intimacy and pleasure after cancer. She is the go-to person on this topic. I honestly believe that. She's internationally recognized as a nurse, as an author, as a speaker, whose work has touched literally thousands of lives. Her book was at the walk I was just at, and it was just wonderful to have that for the men at the prostate cancer walk last September. She spent her career helping people and their partners face the changes that come with cancer, not just the physical side effects, but the emotional and the relational ones too. That's what's so amazing about Dr. Katz. She's written numerous books. This is a very prolific author, including Women, Cancer, Sex, and This Should Not Be Happening, Young Adults with Cancer. I told you she also has Men, Cancer, Sex as well, which was available at the Prostate Cancer Walk. She's become one of the most trusted voices in the world when it comes to talking about sex and cancer with honesty, warmth, and hope. Anne truly has a rare gift. She helps people see that even after cancer, connection and intimacy are still so possible. They just might look at things a little differently, and that's okay. So I am really excited to welcome my friend and guest, Dr. Ann Katz. Welcome, Ann.
Thank you so much, and thank you for that lovely introduction. I was blushing. I normally want to hide when with those intros, but you did a really nice job. So thank you so much. And you really set up my talk, brief as it is, really beautifully with this notion of intimacy and the changes that occur for couples. So
That's
if
perfect.
that's okay,
And
yeah.
two, I would like to, and we're going to talk about it more, but the most exciting thing is Anne has another book coming out in February, which she'll talk about as well. So I'm going to hand it over to you, and it's all you, Anne.
Thank you so much. So let me go and, whoops.
Vic will pull it up.
There we go. Oh, I actually did it. Oh, miracles. So, yeah, so in my clinical practice, if somebody has a partner, I want that partner to come with to counseling sessions because, while sex can be a solo thing, generally when you have a partner, there's going to be some aspect that involves the partner. So I think working with couples has just really been so rewarding for me. And so I wrote this book, and it's called Cancer, Sex, and Intimacy. I actually didn't choose the title. It was a negotiation with the editor at Johns Hopkins Press. And eventually I gave up the fight, but I'm actually kind of quite happy now with how it's turned out, and I actually really like the cover as well. So it's coming out February the 10th, 2026, and is actually available for pre-order now. So that's the shameless self-promotion part of my chat today. So what is intimacy? So one of the reasons that I've sort of bumped up against the word in the past is that very often couples will come to see me and they'll say, we're having problems with intimacy. And my first question is, do you feel connected? Do you feel supported? Is there mutual trust and love? And people always answer, almost always answer, absolutely. Well, then you don't have a problem with intimacy. You may have a problem with sex or sexual function, but intimacy, as this description or definition, I really like it, and I'm going to read this for the benefit of people who will be listening. People think that intimacy is about sex, but intimacy is about truth. When you realize you can tell someone your truth, when you can show yourself to them, when you stand in front of them bare and their response is, you're safe with me, that's intimacy. I really like that definition. Intimacy is about vulnerability. It is about emotional connection. Yes, it's about truth. And I think standing bare is not necessarily naked. It's being completely open. And one of the things I think that, the chaos of a cancer diagnosis will often do is actually increase closeness, and allow people to be truly vulnerable in front of their partner, which makes that connection even stronger. Yes, and I'm going to cover this in a minute. Not all couples negotiate the cancer experience with grace, with dignity, or unfortunately with love and acceptance. But in my experience of a quarter of a century of doing this work, my, that's, that's a long time. I didn't realize how fast time had gone. In my experience, the vast majority of couples actually increase their intimacy, if not their sex life. So what I have covered in the book, and perhaps I can just sort of explain how the book is structured. So this is a book that is meant for couples dealing with cancer. It is written for consumers, for cancer survivors and their partners. But certainly if oncology care providers, if the fabulous urology nurses want to learn a little bit more, and I know you all know a lot. I have spent 25 years working with urology nurses, and if I wore a hat, it would be off all the time, because I think urology nurses really deal with very, very sensitive topics with very, very sensitive people, i.e. men. They can learn from the book as well. So how the book is structured is that there are a number of chapters. I think there are 14 chapters overall, and the vast majority of the chapters deal with the topics that you can see on the screen. There also are chapters on communication and how to find resources, and so not symptoms or experiences that people go through. So each chapter has 2 stories in it. Not always, but most of my books, the vast majority of my books, tell stories, because I think that is how we as humans learn, and people identify with the stories. The stories are composites of various patients that I have seen over the years, and interspersed with the narrative are call-outs with evidence-based advice, guidance for people to negotiate the changes. So there's a chapter on body image changes, and I think we often think that it's only women that have the sensitive body image. That is not true. We certainly see men are often sensitive about their body image. I think, for example, of a gentleman that I saw. He was being treated for advanced prostate cancer, was on androgen deprivation therapy, and had gained that spare tire weight distribution. And he broached the topic with me by his opening statement, which was, "I've had to buy a whole new wardrobe." I thought I knew where he was going with this. So I said to him, could you clarify a little bit? I don't want to go off on a tangent here. And he said, well, traditionally I've worn t-shirts and golf shirts, with stretchy fabric. And now I'm just not comfortable. I don't look good with them anymore. I've had a little bit of breast enlargement. I've got a big tummy now. So I've had to go and buy cotton shirts. So, really concerned with his body image. So there are 2 stories, one with a focus on a woman with cancer and one with a man with cancer. I talk about absence of desire, which is something that I hear about frequently from patients as well as from people in the line at the grocery store. And when people find out what I do, from a brief social chat, they will often tell me their stories, and certainly lack of libido or absence of desire is a big one. I certainly have a chapter on problems with arousal, so erectile problems for men. Not always erectile dysfunction or complete absence of erections, but sometimes it's the inability to maintain an erection, which can be as distressing. And certainly for women, changes, problems with lubrication or lack of lubrication, causing painful sexual touch. I talk about changes in orgasm, which lots of people don't talk about. So sometimes orgasms go away completely. Sometimes it can be that orgasms become more painful, and people may actively avoid having an orgasm because it's so painful. And this is where a pelvic floor physiotherapist comes in, and they do just absolutely amazing work. That sort of runs into the whole issue of pain with sex. But there are, multiple aspects of pain. For example, people who have peripheral neuropathy, the numbness, tingling, sometimes pain in their hands and feet. We often don't think about hands and sex, but our hands are intimately involved in our sexual expression or sexual practices. So if you have lack of feeling in your hands, touching or chain alterations in sensation, touching your partner can be painful. Depression and anxiety, extremely common in individuals with cancer. So depression at the time of diagnosis and beyond through treatment and even after treatment, and certainly anxiety. And the most common form of anxiety that we see in individuals who've had cancer is fear of recurrence. That's a really big one. So I talk about that. And then there's the really difficult stuff. What happens when a partner leaves, and the abandonment and betrayal and sadness and real psychic pain that goes along with that. And to really balance that chapter, which was very difficult to write, because I think, certainly I like to think that everything's going to be unicorn and rainbows, but it isn't always. And sometimes the partner just really can't cope, can't hack it, and chooses to leave. Or the cancer diagnosis and seeing the suffering of their partner sometimes just really is the straw that breaks the camel's back, and the partner leaves. But also there's a chapter on what is the impact of someone's cancer on the partner, and how does the partner cope? How does the partner ask for help? How, why they don't ask for help, and some strategies to really help. And then sexuality at the end of life. And I have to say that every chapter that I have written about sexuality at or near the end of life, I cry while writing that chapter. It's just something that really does touch me. As someone who is partnered, the thought of losing my partner, is distressing, to put it mildly. I once made the mistake of actually reading part of a chapter at a palliative care conference, part of a chapter about sexuality at the end of life, and I could not keep it together while reading the chapter. It was, I'm not embarrassed to cry, but sometimes you just have to try and maintain somewhat of a professional demeanor, and I failed horribly. So those are the sort of major chapters dealing with the impact on couples where one person has cancer. And there's not always one person, really both. If you get to live long enough, chances are both individuals will be touched by cancer. The chapter on communication, I think, is really important. And I often think about myself sometimes as a communications counselor rather than a sexuality counselor. But, we need to recognize that it is difficult to talk about this, even with our partner, especially with our partner. We may talk to our girlfriends or it's weird to say boyfriends about men, but male friends. Men will often joke about sex rather than talk about it seriously, but certainly, serious talks about it do occur. And it's easier to talk to friends, acquaintances, than it is to our partner. So there are, some advice around how to talk to one's partner about it, because it's a different skill set from talking about, who's taken out the garbage, or perhaps a problem that one of your children is having. And then talking to healthcare providers. And this really is something that I find quite annoying, because I truly believe that healthcare providers have an absolute responsibility to raise the topic with our patients, because it's our treatments that cause the problem. So, how do you raise the topic with your healthcare provider who is backing toward the exam room door and wanting to get out of there. And you know, and they know that the waiting room is full of patients, but it's important to have that conversation. And I really do believe that it is up to us as healthcare providers to raise the topic, and then how to find and get professional help. So those are really sort of the important issues I think that need to be addressed, and I do in the book. So that is the formal part of my presentation. I see that there are some questions that I will talk to Dr. Jeff about. Here is my contact information, my website, which is very rudimentary because I just started a new website and I did it all myself and I need help. But it's sort of bare bones, but it's there, and this is how to contact me. I really, if you have a question, please, feel free to email me. I'm always happy to answer that. If you want to make an appointment to speak with me, I practice brief resolution-focused counseling. I'm not Dr. Freud. This is not going to be once a week for 20 years. I can promise you. It's about seeking resolution for you. And that is my phone number, which I have typed wrong because there's an extra 5 there. Goodness gracious me. Okay, that is the formal part of my presentation. Dr. Jeff, let's talk.
Awesome. So much good stuff. And I'm so excited about the new book. That's wonderful. Really wonderful.
There'll be a pop quiz for you afterward.
Yes. Excellent. That's great. And I know our listeners, I think that, first off, I love that definition of intimacy. I've explored intimacy a lot like you with patients, and what do they think it is and what do they believe about it? Because I think often, I don't know about you, but I find many of the patients and couples that I see, they're really concerned about intimacy, that connectionness, that connectedness with their partner, which during a cancer diagnosis, we need more than ever. So that intimacy, that wonderful feeling of feeling seen and heard and really valued by that other person is so important. And again, like you say, where you can show up and not feel judged either. I think it's so important. And so I love the definition that you offered up. That was really fun. And
yeah, I think I just want to say one other thing about intimacy. I find that couples will often use the word as a euphemism for sex.
mm-hmm.
And, I think that just speaks to how messed up we are about sex in our modern society, right?
Mm-hmm.
Sex is used to sell cars and TVs and all kinds of stuff. But we don't always have the words. And I find sometimes that patients are afraid that they're going to use a word incorrectly.
Mm-hmm.
They often don't have the correct terms for their parts, their body parts.
Mm-hmm.
And I know you are not judgmental at all. If someone wants to talk about their ha-ha or their hoo-hoo or their hee-hee, it's incumbent upon us to explain, or to ask. And I would have a diagram. Point to the part where you feel pain. I don't expect you to know the Latin words, and we use Latin words to hide our embarrassment as healthcare providers. Anyway, so intimacy is important, and what you say is absolutely true. People want that connection.
Yes. And like you said, sometimes people, you bring up such an interesting point. Sometimes they're afraid to say, I'm concerned about sex. Is it okay for me to say that when we're going through this really difficult thing? I'm concerned about our sex life too, as well as our connectedness. And, I'll never forget one woman who came to me and she said, why would it take me 7 years to finally find someone like you who can help address some of these sexual issues with me? I brought this up. My doctor told me I'm trying to keep you alive from your cancer. This is not my focus. It's not what I know much about. And she's like, but I've been dealing with this for multiple years and I still want to feel like a woman. I still want to feel like a wife. I want to have sex. And I think it's scary for them to say and ask, but sex is a part of the human journey. It's a part of what we talk about every single day. But I find, and I'm sure you do too, sometimes the patients, they come in and their anxiety level is like And by the time they end, they're like, oh my gosh, I feel like a different person because it's safe and comfortable to talk about all these things no one's ever explained to me before.
Yeah. And on the other side of that is that I find healthcare providers are human, and are afraid of being seen as voyeuristic, of being intrusive. They're afraid that they don't know how to answer a question, which boggles my mind because I sometimes get asked a question and I genuinely do not know the answer to it. And, the answer is, I'll find out.
Mhm.
We have this wonderful thing called, well, now it's AI. Dr. Google, who cares about Dr. Google? Now we can go to Perplexity or Chat GPT or all those kinds of things. And I'll find the answer to it. And the other thing that I tell healthcare providers is that most couples and most individuals with cancer just want to know that what they're experiencing is normal, that they are not the only person in the whole world that is experiencing this. They want validation and normalization that I, as a provider, have heard about this before and hopefully have some suggestions to
Mm.
offer as well. But you do not need, as to the healthcare providers out there, you do not need to be an expert in this. Listen, just keep your mouth shut, which is difficult for us, right? Because we like to talk at our patients. Just listen, and validate. And, it certainly has I think, I hope, made me a better human, because when
Mm.
you learn about other people's suffering and you see the bravery of human beings and the gloriousness, is that a word? Oh, I
Yes,
might just made one up,
beautiful word.
of the human spirit. I mean, what an opportunity for growth.
Absolutely. I think that's true, so true. And our patients are so vulnerable with us by opening up and telling
Yeah.
us their journey.
Yeah.
So I agree wholeheartedly. And I think it's just it took me a while because when you're in healthcare, you think my job is to fix things. But I found the most profound, powerful thing I can do is just sit and truly be present and listen and acknowledge their truth and their story and really be a part of that journey
Yeah.
because right?
Yeah.
So powerful, so powerful.
So,
And that's what you can do for your partner if your partner, because I know it feels very helpless to have a partner with cancer or struggling with whatever, but the greatest thing you can do is show up.
yeah. Yeah, and I think we often, I mean, I know I'm a fixer. I went into nursing because I like fixing people.
Me too, me too.
So, I've had to learn over, oh, many, many decades
Me
of
too.
nursing practice, that I can't fix everything. It's not my job to fix everything, and people will fix themselves in some way, shape, or form. Maybe not the way I would like them to fix, or I would fix if I was in their shoes, but they will. And, success or resolution has many different faces. And I think the other thing is that, and I'm sure, Jeff, you can relate. Sometimes people do say stuff to us that, you know, in your head you're going, ooh, but you have a neutral expression on your face and you kind of nod. And you think, gonna have to look that one up.
It does happen. It does happen to us.
But
It does happen. You think you've heard it all, and then you hear something new. That's
mhm,
it's like you said. What a gift and an honor it is to be a part of these patient and their partner's journey. I love
right.
partners to be involved too, and I think it's just such a gift to be a part of this human journey with people because, like you said, I learned so much from my patients, and it's wonderful.
Yeah. And I think, also as a nurse, I bring as do you, a really unique perspective to the whole counseling arena, in
Mhm.
that we understand the disease processes, that we understand the anatomy, the physiology, the endocrinology, blah blah blah, all that kind of stuff. And particularly working in oncology, we can offer perhaps more than a psychologist
Hmm.
who doesn't have that kind of background. So I feel, really honored to bring that to my work. Um, and I mean, certainly I've learned more than I think I probably needed to know. Some of it's kind of scary, sometimes I don't know if you've ever talked to a first year medical student, they're constantly like feeling their pulses, and every little cough or sneeze they think is some catastrophic illness. And sometimes when just that little bit too much. But yeah, it's certainly, I mean, it's just what an honor it has been to work in this area. It's yeah, it's amazing.
It is. I was thinking as you were speaking about sometimes the tears that come to your eye, and I have to tell you a little story. Anne won an award from something called STAR, which is the Society of Sex Therapists and Researchers, for one of her books. And I was part of the review team for those awards and stuff, and people were talking about how I was crying when I read this book. So I think what's amazing about your books are the stories.
Yeah.
Everyone has a story, and you tell the stories. And so it's so easy to read and so comfortable, and it's all presented in those story formats. And I think that's a really wonderful way to help empower and give people information they need through the power of stories. So I really appreciate that, and can't wait to read more stories in your new book.
Yeah, and I have to tell you, I've also written textbooks, right? And I must tell you that writing books for consumers or survivors is a joy, right? Because there's creativity involved and it's not dry. And my process is my process, and I look forward to the writing, because yeah, it's lovely to tell stories, and that is how we learn.
Mm.
And so the books have all been a joy, and this one has been a particular joy, I think. um every time someone says, how many books have you written? And I have to think really hard. And after 5, I kind of stopped counting. And I think this might be number 17. I'm not, it's either 16 or 17. It's a lot of books. And not all of them are still in print, which is, yeah.
Amazing.
It bothers me that some of them are not in print anymore. Um,
Mm,
but
gosh.
Yeah, I've liked writing since I was a little girl.
Mm.
So how lucky, how fortunate am I to have found this outlet for my own creativity. Now I've started to knit again, and I have to tell you something. Writing stories is way better than knitting. I'm finding,
I
I'm
love
finding
it.
this,
I love it.
I'm finding this knitting is somewhat frustrating. But let's maybe get to some of these
Yes, I'm going to
questions,
start. I was thinking the same thing. The
because it's
first
starting
question.
to feel like therapy, I have to tell you.
Yes, this is the first question. Here we go. All right. So my body has changed a lot after treatment, and I don't feel attractive anymore. How do I let my partner know in what I'm struggling with my self-image?
Yeah, such a great question. So, firstly, we are our own worst critics.
Mm.
We see things on and in our body that our partner does not see. Um, I often talk about lust as blinkers, and I think, one of the other things is that often if you've been part of a couple for years, things change with time. I mean, our bodies change, our emotions change, our irritation changes, uh,
Yes.
our ability to share, our ability to be truthful changes. And we all long for those initial days where you can't get enough of your partner, etc., etc. It's
Mhm.
actually called limerence, and it doesn't last very long because we can't maintain that intensity for any length of time because life gets in the way, and that tends to go away. But really, our partners um, see the essence of us. And
Mhm.
what I've often talked about in counseling with people is when someone will say, and it's often women who say, and they'll turn to their partner in the session and say, how could you possibly want me? Right? I've got a breast missing, or I've got the scar, or my reconstructed breast just doesn't look like my other breast, and or there's something missing, or whatever it is. And the poor partner is sitting there like a deer in the headlights. And it's like, do I look fat in these jeans? They're never quite sure how to answer it, and the answer is no. Um,
Yeah.
um,
Right.
and I will often at that point just step in, because you have to rescue the partner. And I'll say, look at your partner. Does he or she look the same as they did 20, 30, 40 years ago? And everybody laughs, because patently we don't. Do you love him or her any less? And they'll say, no. He's been the most amazing partner to me, and he's an incredible father, and now he's a grandfather, and he's an even better grandfather, and he's kind, and he takes the garbage out without being asked. I love him more, if anything. Okay, there you have it, right? Grant yourself the same grace,
Yes.
right?
Yeah,
Um,
that's so true. And I mean, Anne, you're hitting Dr. Katz. It's exactly right, because if anyone talked to us like we talk to ourselves, you'd say that was abuse, right? We're
Absolutely.
and we see all the flaws and all the things that are wrong. And all of us think, oh my God, naked, this is a scary sight. Everybody feels that way. As you get older, it more and more you're like, oh my gosh. But like you said, because even, my wife will say to me, I don't even know why you're attracted to me. I don't look like I did it. And I'm just like, are you kidding? It's just, I see something unbelievably different than she sees, and the same the other way around. So I think you're so right that it's your partner sees the beauty of who you truly are, not all of the
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 stuff.
the stuff.
Yeah.
So
Yeah.
yeah, great question though.
Yeah.
Great
So,
answer.
so I think, granting yourself some grace, recognizing that you really are your harshest critic, and be truthful about it. And the other thing is, you don't actually have to be naked, right? In order to enjoy whatever sex is. And it isn't necessarily penetration, and it's certainly not swinging from the chandelier, because I would not advise that for you. Um, you can cover up the parts that you are embarrassed or ashamed of, that you can't relax, because relaxation is so important, to actually be present and to be enjoying whatever the touch is.
Yeah.
So cover up, right? I tell women, be careful about going off to, that lingerie store and getting something that's got like bits of fur on it, and, there are seams and wires and all kinds of stuff, because particularly for women who've had breast surgery, those can be really uncomfortable. Um, a man's cotton shirt for a
Mhm.
woman, right?
Mm.
You undo or
Mm.
do up the buttons as you see fit.
Perfect.
For men, get yourself like a silk smoking, well, they call them smoking jackets. Don't smoke, but wear something that makes you feel comfortable. And if you're somebody who has a ostomy bag, an ostomy therapist or an ostomy nurse can provide you with suggestions around how to anchor that bag, so that there are no oopsies, or minimize the risk of oopsies happening. There's a ton of stuff that
I
you
had a
can do.
patient who started designing ostomy covers for the bag and everything, and they were beautiful and
Hmm.
brilliant. So you're
Hmm.
so right. And it's so funny that you brought that up, because as you were talking, I was thinking about the ostomy bag covers, and I thought, what a brilliant, beautiful idea. So
Hmm.
there's so many things out there, and fun ways and exciting ways to do it. I love the idea of the smoking jacket, or the evening,
The robe, the Hugh
whatever,
Hefner robe.
the robe.
Yeah.
It's
Yeah.
definitely, trust me, because as we get older, there's lots of things here that I'm not uncovering all this. It's like,
Yeah,
so we
absolutely.
get it. We get
Absolutely.
it. Really
Yeah.
good. Really good. So the next question was, what do my partner and I do when we have different levels of interest in sex after cancer? One of us is ready, one of us is not.
Yeah, that's a big one. Um, so, I think there's some mythology around this topic. We assume that men are like that Energizer bunny, boom, 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 always ready. Not true. So that's the first thing. We become very cemented in what we in the business call sexual scripts. So the way that we are sexual with our partner. I will sometimes joke about, Saturday night, 10:20, jammies on in the dark. That is a sexual script. Hopefully, well, if it works for you, it works for you. So we become very cemented. So we're, often the initiation of something of touch, let's just say, falls on one partner and not the other, and it's comfortable, and you kind of don't have to think about it, and you sort of get into that as a practice, as a rhythm, and it's difficult to change that. So the other thing that I find is that particularly for women as they age, sexual thoughts, fantasies, and initiation or desire, sexual libido becomes less spontaneous and more responsive. So there is a difference between the responsive desire and spontaneous desire. So spontaneous desire is what happens often in the beginning of relationships. You can't wait to get your hands on the other person, right? Just thinking about them is a turn on, right? That's spontaneous desire. Responsive desire, on the other hand, is something that'll often go along with arousal. So that if you can find your way to allowing some form of touch or kissing and canoodling, right? Cuddling, whatever. Often that is for women when desire comes in. This is a concept that has been developed and tested in clinical trials, started by Dr. Rosemary Basson. She's from the University of British Columbia in Vancouver. People are looking at this to see if it actually applies to men as well, and I think it may, because we're not all that different. The idea that women are so complicated and men are like an on and off switch, not true. Men are complicated. You are complex beings, particularly in regards to sexuality. Big learning lesson for me. So once you get something started, often that is when desire kicks in. So that is responsive desire. And it can't just be like sitting close to your partner while watching television so that your legs touch, right? And you hold hands instead of sitting, on opposite sides of the den or the living room and watching Netflix. So I think that is really important, to recognize that you don't have to be desirous at the outside. That can grow. There's also, this is work that comes from Dr. Emily Nagoski, fabulous author. Her books are fantastic. Come As You Are. There's a workbook associated with that, and there's another one as well. The title, it's in one of the bookshelves behind me. I can't quite remember. And actually, I think actually does focus on couples as well. And she talks about brakes and accelerators. So there are things that act as sometimes behaviors, it could be words, it could be actions that act as accelerators for us. I joke about taking out the garbage without being asked. That can be a turn on. And then there are brakes, like brush your teeth, damn it. A not clean mouth can be a big old break, or a dismissive statement over dinner can really change any hope of getting anything to happen. And those are obviously silly examples, but those are sort of two different ways of looking at this whole issue of discordant desire. I mean, this is what that question really is about. Different levels of interest is discordant desire, and it is extremely common. And it's not always the woman who has the lower level of desire.
Absolutely. And that's where I really, truly believe Basson's model applies to both men and women. Again, some people are more linear, like the Masters and Johnson's model, but many people are more like Bassan says, they need emotional engagement. It doesn't just appear out of nowhere. And I think you're absolutely right. But I was thinking too, what I do too with my couples, especially with the cancer diagnosis, is from the beginning, we kind of check in with them and see if they're okay with this before we have this conversation together as a group. I'll check in with each of them and say, okay, while these treatments are going on, you may or may not be feeling as sexual. You may be tired. You may have all these things going on. Your partner still has that desire, still has all those things. Can we talk about self-stimulation and that they can just move forward with, those releases and taking care of themselves, whatever is needed? And most of them are like, oh, I'm so glad you brought that up. And yes, let's do talk about that and make sure. Sometimes I find they're like, I don't have anything going on, but I'd love to participate in your pleasuring yourself and me pleasuring you along with you. And certainly take care of yourself. I don't have the energy or strength for it right now, and it's okay with me. Those conversations, I know they seem really foreign, but the more you do talk about things, the easier it becomes. So we talk about those things and kind of get that out in the air too. It's like, whatever needs to happen to get us through what we need, what we're doing in the most wholehearted way.
Yeah. And Jeff, you are skirting around the word masturbation. So,
Yes, definitely.
and one of the things that I think is really important for people, particularly when they're, ready to engage again, is some self-exploration, i.e. masturbation, to figure out what feels good, what doesn't feel good, so that you can show and or tell your partner, I know that when you touch my chest wall or when you touch my reconstructed breast that you're showing love and acceptance, but it doesn't feel great now after my reconstruction. It kind of feels numb. That does change over time, but it may never feel or respond like the unaffected breast, and your partner needs to know that, right? Because they are going to want to show acceptance, right?
Yes.
And if you don't tell them, kind of like faking orgasm, 2 years down the road, it's really hard to go back and say, I've been lying all this time. So some self-exploration for both men and women to figure out what feels good.
Absolutely.
Where, what has worked for 25 years doesn't work anymore. I need gentler touch, or I need firmer touch, or we need to get a vibrator.
And we all are responsible for our own orgasm. So I'm responsible to help you know what it feels good and what feels right.
Absolutely.
So,
absolutely.
And that removes the pressure. It's not on you to make me orgasm. It's on us to work together, and I'm responsible for my own. And let's face it, Anne, too, even without cancer and everything, right now you may feel like I want things very slow and tender and whatever. And sometimes you may want it totally different. So that communication is so vital.
Important.
We talk about it on the show all the time. So important. I have a final question here. How can my husband and I, as an LGBTQ plus couple, find resources and support around intimacy after cancer? It just feels like everything is geared towards heterosexuals.
Yeah, it is. Well, but no, not everything. I mean, certainly there are resources, and I've got resources in all of my books. The last chapter is always resources, and there certainly are organizations with a focus on what I call sexual minority individuals and couples, because I get the LGBTQ A plus, and in Canada we also talk about two-spirited people in our Indigenous population. There are resources. They're not off the top of my head. My apologies. I'm postmenopausal. And they just do not
even
reside.
more reason to purchase the book. And I know the book. I've read all your books, and they are very inclusive, and they are, because everybody's everybody. And so I think it's wonderful.
And there are always stories about sexual minority patients in my books. Because they are part of our world, right? We're all humans, and we all have the same emotions and the same issues and the same challenges. I worked in HIV/AIDS for years back in the late 80s and early 90s, and we had the saying, it's not who you are, it's who you do. I think that's what we used to talk about.
Yes.
Yeah,
And love is love.
love is
Love is
love.
love, and sex is sex, and it's all good. And like you said, so we really do want you all to know everyone wants to be seen, heard, and valued. And I know you see, hear, and value everyone in your book. So
Yeah.
I'm so excited about your book. Definitely. When I come back after our closing exercise, we'll both give a little bit of our final thoughts. If you want to think about that a little bit,
Sure.
I'm going to do that closing centering exercise and come right back to you. Been such a great episode. I can't wait to come back to you and finish up. But let's do a little centering exercise as we do. And so join me in that. So before we wrap up today's episode, let's take just a few moments, as we always do, to center our beautiful, miraculous selves. If you can, it's all about breathing. Take a deep breath in and let go slowly. You can close your eyes if it feels comfortable, or just soften your gaze. Get comfortable in the chair or whatever you're in. Feel the chair or the floor or the couch or whatever supporting you. You don't have to hold everything right now. Let go of it. Breathe deeply. And as you breathe, as you exhale, release anything that's no longer serving you. Think about someone you love, or even better, perhaps, think about yourself, and send a little warmth, a little compassion your own way or their way. Life changes us, sometimes in ways we never expected. Cancer can be frightening, but you are so much more than a cancer diagnosis. And love, closeness, and tenderness, they're still there. They're waiting to be rediscovered in new forms. Breathe in connection. Breathe out fear. God, let it go. Breathe in compassion. Breathe out judgment. Let it go. We judge things constantly, every day, over and over. Let it go, let it go. You are not alone in this journey. Intimacy isn't lost. It simply transforms. And in that transformation, there is room for healing, growth, and love. When you're ready, take one last deep breath and open your eyes, bringing that gentle awareness with you into the rest of your day. Vic, can you tell us what is coming up next week on Dr. Jeff Talks About Sex and Intimacy?
Dr. Jeff welcomes author and relationship theorist Zoe Charif. Zoe spent over a decade collecting data, interviews, and stories to develop her groundbreaking theory that love can be calculated. Can we really use both our heart and mind to make smarter choices in love? Zoe and Dr. Jeff explore the balance between emotion, logic, and chemistry, revealing how patterns, behaviors, and self-awareness play into finding a meaningful connection, whether you're single, dating, or in a long-term relationship. This episode offers thought-provoking insights into how love, attraction, and compatibility may not be as random as we think. Join us on November 11th at 7 p.m. Central. Time to learn more.
I'm looking forward to that. I've read her book, and it's pretty amazing. And I think it's kind of fun and interesting how she has some calculations she does to see how do you find the right person. And if you're with the right person, how do you stay and make sure that these things align in terms of values and needs and things like that.
Interesting.
Should be a very interesting episode. Well, gosh, this has been awesome. And so what are some of your final thoughts you'd like to share with our listeners tonight?
Simple question, difficult to answer. I think for me, there is always hope.
Mm.
And I'm actually not a natural optimist, so I've had to work at this. um, I think people generally will seek help because they're extremely distressed. It takes them a long time to both find help. The woman you saw who it took her 7 years to find, and I mean to find you. And I think that's awful because, if you work in oncology, you should know. And if you don't know, you should find out where you can refer patients, because you can't be everything to everybody. Urology nurses can put in a catheter like nobody's business,
Mhm.
right? And they can take out that catheter and they can do wound care and they can, educate patients about surgeries and all kinds of stuff. That is their sphere of professional responsibility and knowledge, right? And sometimes I think it's important, stay in your lane, man.
Mhm, mhm.
I would no sooner um, put in a catheter than I would, try to walk on water. Um, but know where you can send your patients. It's important. It might be a social worker in your institution. It may be a psychologist. It may be a family physician or nurse practitioner, or it may be one of your colleagues who has an interest in human sexuality and has done some reading and will listen, right? Um, so it saddens me that people are left for a long, 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 long time without help. Uh, you know, Patients have often said, why aren't there more of you, like more of me around? I don't know. I mean, this is often not something that is financially supported by institutions, which I think is an absolute shame,
Mhm.
right? Because we need to do more than treat the cancer. We need to treat the person.
Mhm.
So I think that uh, um, it is a shame that it takes people so long to find help. One of the reasons that I've written these books is also to help people who live in rural or remote areas who are not being treated in big cancer institutions where there may be and generally are social workers, for example, who can be helpful, because people often are shy or they don't have the money,
Mhm.
right, to pay for counseling. And, we also have to put bread on the table.
Mhm.
Um, and I've had to learn that the hard way. You can't do stuff for free. You sell yourself short. But you can spend $23 on a book and you will find something in there that can help, or will give you the words to actually go to somebody and say, hey, I need help, this is what I'm going through. But there's always hope, and I am always heartened to see how people find their way. They find their way back together. They find
Mhm.
their way through this highly traumatic experience that is cancer, that, is a psychic blow, right? As you started off, and perhaps this is where we'll end because it's a full circle. Cancer is an experience of uncertainty.
Mhm.
And as human beings, we do not do well with uncertainty. We think we know how things are going to go, right? And how our life is going to play out. And cancer changes everything.
It really does. And Vic just put up the banner for ASECT where you can find providers there. So if you're looking, or if you're a healthcare professional, you don't know where to send people, that's a great resource. That's where a lot of us who are certified sexuality counselors, therapists, and educators are a part of that and certified by them. So thank you for putting that up, Vic. That was great. I saw that underneath us, and he's
Yeah, I did too. Yeah,
it's
it's a
so
good resource.
awesome.
STAR also, the Society for Sex Therapy and Research, also has a sort of find a provider.
Mhm.
And if you just Google STAR,
Mhm.
you will find your way to the website. I think the website is starnet.org.
Mhm.
You can also find providers there.
Definitely. So I would say I think you're right. Hope is such a powerful mobilizing thing, and I think that what's wonderful is there is hope, listeners. There's such hope out there. And know that I really think you will find hope. I've found it in each of Anne's books. Dr. Katz has written some wonderful books full of hope. And certainly I hope that my greatest hope is that this inspires you to know that with cancer, love and intimacy are still incredibly possible, and you are beautiful and miraculous and so much more than cancer. So we thank you so much for joining us. I thank my guest, Dr. Katz. It's always such a pleasure
Always a pleasure
to be with you. And thank you, listeners. You're what we're all about. Thanks for being here. Have a good one.
As Dr. Jeff talks about sex